Hi, I'm Dr. Claudia Kim. I'm a cosmetic surgeon here at New Look New Life, and today we're going to talk about facial volume or facial balancing. When we evaluate the face, we always have to think in terms of proportion, about symmetry, and also take into consideration the natural changes of aging. Now, everyone starts to explore injectables such as neuromodulators or fillers because they are starting to see some changes to their face that come naturally with age. Some individuals who are younger may also be seeking to change some aspect of their face that is not attributed to aging. But I'll start off with the aging part. For the natural progression of things in the face, what we commonly see is that we lose elasticity, we lose collagen, and we lose a volume to the face. So when I approach the face, there are always 4 factors that I take into consideration. Okay, so the first one is the lines on the face, right? Wrinkles. And this is caused by constant muscle use. Think of your face as a piece of paper, and you're constantly crunching up the skin, and then the longer you do it, the more the lines are on that piece of paper or your skin. And that's what we address with neuromodulators. Number 2 is volume. So again, as we age, we lose volume to the face. A lot of the times patients will see that in their photos 10, 20 years ago that their cheeks were much fuller, or they had much more volume to the temples, or their lips were fuller. The natural progression of things is that we lose volume. It's fat atrophy or just fat kind of going away. So that's volume. The third one is texture. Texture in relation to pores and the fine lines, which are different from wrinkles, but it kind of acts a little bit differently, but it's the surface of things. And the last but not least is the laxity of the skin. Most commonly it's kind of like the jowls here, like the sagging of the neck, or my patients like to say their gobble neck or the turkey neck. So when we address facial aging, it's not appropriate to just address one thing. And at some point, you do have to address all 4 things when we look into facial rejuvenation. Because if you really just do one, the other aspects of the facial symmetry are not going to be addressed. So a lot of the times, we do have to do a combination of neuromodulators with fillers or fat grafting for the volume, some kind of laser resurfacing modality, right? So the medical grade lasers, and something for the skin. So not one device or one product is going to help to treat all of it. There are some overlaps, but again, it is a combination of more than one modality. There are some predictable changes to the face that we can see across different people, different ethnicities, and also different ages. And one common factor or one common change that we see is that we lose this structural support in the mid-face region. So that mid-face region is the cheek area. And so if you look at photos from when you were, let's say, in your 20s, you'll commonly notice that there's a lot more volume to the cheeks and a lot more height to the cheeks. But because we are losing, again, the elasticity and the volume, the mid-face support starts to go down. Gravity will always win. And so what do we see with that kind of change? We'll see that the nasolabial folds here, so it's that fold or that line from the side of the nose to the corner of the mouth, nasolabial. These lines start to get more prominent, right? The cheek here, or the malar fat pad, it starts to go down and it starts to get a little bit more sunken in. So when you imagine this part here, which is a structural support, starts to go down, you start to get more hollowness in the under eye region, stronger nasolabial folds. You get more prominence of the marionette lines. So if you remember like the old school, puppets, the marionette puppets where the mouth goes up and down, that's why it's called the marionette lines. I know it's not very flattering, but that's what they call it. And then you start to see the jowling, which is the skin sagging down here. So a lot of the times when patients are like, oh, I'm bothered by these lines, I'm bothered by these lines, we have to actually address the support system. If you are like, why do I need cheek filler? Because this is what's causing the rest of this. I know it seems very overwhelming when all you wanted to go in was for wrinkles on the forehead and your provider is suggesting all these other stuff. Is really to provide balancing to the entire face. Always keep in mind that because we know the face as a whole and we do need to treat the patient and the face as a whole, keep an open mind, but never feel pressured to do something that you really are uncomfortable with doing. But make sure you do your research so that you can find a provider who is reputable and trustworthy that can help you on your journey. Hope that helps in regards to facial balancing. Stay tuned for more videos like these. Thanks.